Hi, everyone. I am here with Laura Wong, and this is part of an ongoing series to introduce everyone to the local healing community. And Laura Wong is a licensed acupuncturist who works at Gen Care. So she's already doing great work in the community. But what I really wanted to spotlight today is Laura's other profession, which is medical Qigong. Now, I do Qigong and I am an alternative practice as an acupuncturist, but even I am very curious and don't know very much about medical Qigong. So, this would be a great opportunity for me to learn and spread the word on the good work. So, Laura, welcome.
Hi. Hi, everyone.
So, Laura, tell me, what is medical Qigong? What's the history? When did it come about? Who started it? Who named it? And just give us a brief overview of what it is.
Well, it's actually a precursor to acupuncture, so it came into being prior to acupuncture, since acupuncture is an energetic medicine, but we use needles to help the flow of that energy go in the body. Prior to that, it was purely an energetic form of healing, Eastern medicine. And so Qigong is under the umbrella of Chinese medicine, but it is the precursor to pretty much everything that we do as acupuncturists and modalities and all of that. So it's basically an energetic transfer. Either if you're practicing yourself, like a qigong form, then you're pulling in chi, the healing chi from the universe into your body to help everything regulate and heal and strengthen and everything. If you are um, receiving treatment from medical qigong as a patient, then the practitioner is using training to move healing energy into your body in specific places, specific ways that will help with what your issues are.
Okay,
So oh, sorry, go ahead.
so for just backing up a little bit, for people who might not be aware, what is Qigong?
Qigong is a modality that usually in the term of just Qigong itself, it's along the lines of Tai Chi, yoga, things like that. Except this one's sort of based in Chinese medicine versus Ayurvedic, Indian, or anything like that. And it's basically a practice of usually some meditation, breathing exercises, and body movements that facilitate the you being able to take in the healing energy of the universe to help your body become the best it can be, or heal if you have issues going on. Usually, there are many different forms out there, at least like thousands of different forms that you can learn, utilize, and they go into different categories. So some are more martial in form, so that's like um, more the like crazy Jackie Chan stuff that you can kind of see in those movies when they train before they like learn how to fight and all that stuff. Um, Pulling in energy to strengthen their bodies and prepare them for a fight, help their agility, help their actual strength and their ability to be precise when striking an opponent, that sort of thing. There's also qigongs that help on the defensive end of martial training to help keep your body strong enough that if you get hit, it doesn't injure you as much as it could. And then on the other side of the flip side of that, you sort of have the more calm, centering, healing, meditative qigong forms, which is one of the forms that I do, where the focus is more on calming the mind, bringing joy to the soul and the heart, centering and pulling in energy to help you be calmer, happier, and healthier. And that's a little bit more along the lines of the form that I know and that I teach people, and the energy that I use in my treatments.
So that's really cool. When I studied Qigong in San Diego, I had a teacher who belonged to the same lineage of teachers who actually trained Bruce Lee.
Oh, no kidding. Oh,
Yes.
that's really cool.
When we talk about martial arts, we think of like the very physical, like karate, judo,
Hmm.
aikido. And so people are like, yeah, of course, we'd work out the body to be stronger and make muscles and learn how to do the strikes and all of that. But
Hmm.
what people don't often realize is Qigong and that energy work is such an integral part of it. So my teacher would give
Absolutely.
these demonstrations where he would just have us stand in a circle around him, and he wouldn't even lift a muscle, but at various times, if he chose you, you could feel yourself like actually being pushed
Hmm.
force. And he also had this cool big bin of spoons and knives and forks that he had bent just purely.
Oh yeah, using the energetic force. Yeah.
So
And
people,
people are like, that doesn't really exist. I'm like, no, it's a real thing. Trust me.
yeah, it's real. It's
It's a real
definitely.
thing. You can throw people across the room without touching them. That's a real thing.
So I take it that the phrase medical qigong was instituted to imply that there is a healer involved who
Yes,
is actually directing that energy for you, or
in a
um,
beneficial way. Yes.
right, using powers for good. Uh,
Yes, exactly.
so that's really cool. So if, first of all, who should seek out medical qigong? Why would someone benefit from it?
Oh wow. Pretty much anyone. Anyone, any age, any issues or no issues. I mean, it's one of those things where, like, sort of going back to what you were saying about like people like, of course, you should work out the body, like make sure your muscles are strong and tendons and ligaments are limber, and so people go to the gym, people want to stay in shape, that sort of thing. That is very good for conditioning the body. The other flip side of that, however, though, is that the body also needs something that allows it to rejuvenate after you've put forth a lot of energetic effort. You need something that will kind of bring balance back, like rest and rejuvenation back to the body, sort of along the concept of like yin and yang in Chinese medicine. Yang is that super active, warm energy that drives all the functions of the body, versus yin, which is very cooling, nurturing, and more along the lines of restoring everything and keeping everything calm and nurtured. So the when people high activity athletes like triathlon people, stuff like that, like they also have to make sure that they're giving their body enough rest to be able to do then all the things they need to do and not risk injury or harm. So where medical qigong kind of comes in to that is helping the person on the restorative end. Like, you're putting forth all this effort, now let's make sure your body's nourished enough to keep doing what you're doing.
Mhm.
Also, people will work on their diet, work on make sure they get enough rest and stretching and all that kind of stuff. Medical qigong comes in on that end of the spectrum, but it can be used for pretty much anything or anyone. Whether you're a crazy athlete or you're a couch potato, whether you are 3 years old or whether you're 102. Doesn't matter what profession you have, anything. If you have medical issues going on, of course, it's helpful to try and resolve those in a way that doesn't involve medication, surgery, other things like that. Also, if you're perfectly healthy, there's always a way to optimize what you have going on already and keep you as healthy as you can. Qigong and Chinese medicine, especially, are really involved in prevention and maintaining a, a good level of health so that you don't have to fix anything. You just avoid it naturally. And that way you can just be good. So qigong is, if you're practicing it on a regular basis, it can help your body stay healthy and keep you on an nice even keel mentally, physically, emotionally, spiritually, all that stuff. All those are important in maintaining and optimizing the body's ability to do what it does, which is keep you alive. And uh, the other aspect is if you have actually issues going on, then of course we can help to do the best we can to get your body back to a good homeostasis place where it bothers you as less as the least it can. Side effects are minimized. Medications might be able to be minimized, that sort of thing. So all of this is sort of along the lines of what, acupuncture does too, except no needles, which is kind of a bonus for some people.
Okay.
So,
Since you do acupuncture,
yes.
um, when would you say to one of your clients or someone you meet on the street, hey, I think you could benefit from medical qigong versus just the acupuncture? Or is there, a case, certain cases where you would recommend it for a particular person versus acupuncture? Or do you think they
Mm,
go hand in hand?
yeah, yeah. So the really great thing that I've discovered about utilizing medical qigong to help people versus just the acupuncture itself is medical qigong is just way more versatile because it's an energetic transfer. So you're not limited to what needle placement and flow of energy, getting a flow of energy going that way can do. So, for example, say someone's coming to me for um, like depression, anxiety, something like that.
Mhm.
Um, while yes, the acupuncture is of course good, and I would utilize that. Obviously, you also do herbs, so like an internal medicine can go a long way very quickly towards resolving that sort of thing. Qigong is sort of the same way. It's a way to get internal, but without ingesting something. So if someone comes, like I said, for anxiety, depression, mental, psycho-emotional issues, I can, instead of like utilizing certain acupuncture points and getting a flow that way, I can go straight into like brain cortexes and be like, okay, so you kind of have this going on. This kind of might be in your history, regardless of what you told me or haven't told me. I can go in and sort of scan energetically all the different brain cortexes, kind of be like, okay, so these are the ones that seem to be having an imbalance issue. Let me send energy to these places to help correct that and um, change the flow to a more happy, loving, consistent, good chi flow, instead of a stagnation or too much heat or the kind of things that we talk about in Chinese medicine, to help right that flow. And with qigong, you can get pretty much anywhere in the body directly, which is a real bonus. And also, since a lot of acupuncture, what we utilize in the needles is also the ability to get someone kind of calm and happy and into like this nice beta state where they get out of the way and their body can really take in and heal and get to that like rest restorative place. And sometimes they fall asleep, sometimes they just get really happy and daisy. Qigong does the exact same thing. So it gets people into this really nice, like calm, like place where they can just kind of zone out and fall asleep if you want to, and let the body take the reins rather, and like really, you know, have time to do what it needs to do. And I also feel like it helps a lot just in general right now too, with people being kind of really stressed out, especially right now, having that restorative time away from your phone, away from people, away from everything, and just kind of be bathed in this universal chi that's like very pro life, pro good, pro joy, all that stuff. Being bathed in something like that versus what you have around you a good chunk of the day is a really restful and restorative thing. So it's a good way to get what you need done. I can do what I need to do in a way that's a little more direct and a little bit faster than just acupuncture alone, kind of like you with the herbs.
Okay, so walk me through it. I'm coming to see you for the very first time.
Yay!
Hi, I walk in the door. Hey, Laura, I'm here for my first session. What do you
Yay!
expect to happen? Like, what is the session like?
So if you come in, we have like a short 2-page intake that just get very general stuff. So I have an idea of like your basic parameters. And then we're gonna sit down for a little while and talk about, what's going on in your life. If you have a specific issue that you're coming for, or is it just kind of like overall balancing or and sort of what's your general your general picture of kind of what's going on. You can get specific or non-specific as you like.
Mhm.
And then there's no clothing removed. You're just going to lay down on a massage table, and I'll offer you a blanket if you want. Most people really like a snuggle, snuggy something. So, and you can curl up, you can lay flat, you can do whatever you want. And I will tell you, okay, so I'm going to get to work. You just close your eyes, take a few deep breaths, relax. And if someone is seeming like they could do well with a little like calm meditation for a few minutes, I'll kind of talk to them about like, like let go, relax, take some deep breaths, like get into the moment, get into your body, and kind of let people kind of just really let go of everything they have going on before they stepped in the door. And then I go to work, and pretty much I will be on one side of you, and we'll kind of decide what side feels best. If people are energetically sensitive enough, I will usually stand on one side and send energy for like a couple, maybe like 10, 15 seconds, and then I'll go to the other side and do the same thing. And people who can kind of tell, like they'll be like, the right side feels better or the left side feels better. And I'll be like, okay. And I usually have a sense, and most of the time it lines up. If the person's aware enough, they're like, it's the right side. I'm like, yep, it's the right side. So, and so I'll go to that side and I'll sit on a little exercise ball thing, and I don't touch you the whole time. And I just send energy to places that feel like they could really use some help and some energy. It's similar in experience to Reiki, if people are familiar with that at all, an energetic transfer just like that. Only the difference is you're using Chinese medicine theory and channels, and the way that things connect and line up to get more specific in the um, healing properties of that of healing properties of what you can get done with Chinese medicine. So usually the session's about, or treating is about 45 minutes to an hour. Most people fall asleep and are snoring by the time I nudge them awake. And then we talk a little bit after about anything you felt like you noticed. And then I'll kind of talk to you a little bit about what I found out, and anything I think would be beneficial for you, like homework wise. And then we'll set up another time if for whenever a good amount of time is, depending on what's going on. And that's about it. And you get a big hug on the way out if you would like one.
So while you're doing the treatments, you said there's no touching. Do you ever talk? Like if you notice something, do you ever ask questions or?
Not usually. Well, it depends on what the person has going on, and it also depends on how the person is doing during session.
Mhm.
Like if they're kind of seeming kind of restless or like moving around a bit and not kind of relaxing, kind of be like, do you need another pillow? Do you need warm? Do you need cooler? That kind of thing? Or is there a certain sensation going on in your body that's kind of like, keeping you from relaxing?
Mhm.
Um, some people, if they have never had energy work or aren't that aware of that stuff before, they get a sensation, you can kind of see them be like, oh, something going on there. And I'm like, yeah, it's your chi, just saying hi. But most people, kind of will notice things, but usually eventually they end up asleep. Um, but yeah, no, there's no, um,
It's not talk therapy.
no. That kind of thing. And so, but every now and then, if there's something I feel like I need to guide someone through, I'll kind of mention like, hey, by the way, so I'm gonna kind of do this or whatever. And there are a couple of techniques where I use that I can use that are on the body, like, and I'll usually kind of tell the person up front before we start, like, hey, towards the end, I'm going to do a sort of kidney hold thing. So I'll place my hand underneath your low back or whatever, and you'll just feel warmth, that kind of thing. But and I'll tell them in the session, like, hey, I'm just going to do the kidney hold now. So you just relax and you're going to feel my hand kind of thing. So, but other than that, it's not I'm doing this now. I'm doing this now. What do you feel now? No. I want you like mentally out of the way and in la la land.
Okay. So what is a typical amount in terms of frequency or duration of a treatment plan? Or
Hmm.
are some people one and done?
Some are. And sometimes I've had clients where it's just a matter of this certain, like a tweaking of something, or an energetic, like getting everything to line up, and the person has this like aha about like life or something that's connected to something else. And then, I check in with them a couple days later and they're like, oh my God, this is so different now. And I'm like, there you go. And I'm like, I'm always around. Good job, bye. And then there are other people who are coming for either like chronic pain type stuff like arthritis or something like that, or some psycho-emotional stuff that they're either working through with a therapist and need want to kind of come and keep their progress flowing well. Or you just have something that you're working on with your doctor that you'd like, some help on the help on the side to kind of minimize either side effects for something you have to do, like, or you know lower medication dosages, things like that. Then that kind of ends up being a longer treatment plan. Usually after the first session, my basic idea is to give everyone about 2 weeks, to give the patient about 2 weeks to kind of see how everything's going, that sort of thing. I'll usually check in with people probably 48 to 72 hours after their treatment, because energy has a 24-hour cycle to go through the body entirely, kind of like circadian rhythm, that sort of thing. Um, During which time, like, things are kind of getting balanced and tweaked a little bit here and there, and your body's taking in everything that has been done in the session. So I give that a chance to go through. And then I usually check on people like 2 or 3 days and kind of be like, hey, how you doing? Like, anything you noticed or anything like that, and check in with them. And then usually after the first session, usually I book for 2 weeks out. But of course, if something major is going on or something major happens in between then or something like that, then I'm like, okay, let's have you next week. Or if they're doing really well, it's just more of like a tune-up kind of thing, I'm like,
Mhm.
a month. Or you can call me when you feel like you need me. I usually have people come in during the change of seasons, because that's a time that the body has a harder time trying to, like, where am I right now? So a qigong session can really help smooth everything out and make that transition easier.
That's really cool. Now, I know a lot of practitioners, even medical doctors right now, are doing telemedicine. Is
Yeah.
medical qigong something you can do long distance?
Since it's an energetic medicine, there are no physical boundaries, I guess you could say, that I have to worry about. So right now I do have patients that I'm working remotely with. So it is sort of the same, but not. So, like, I'll call the person, say we had a 2 o'clock appointment. I'll call them at 2 and be like, hey, tell me what's going on, blah, blah, blah. And they'll be like, and after we kind of chatted a bit, I'll be like, okay, so I'm going to hang up and I'm going to go to work, and you just go lie down, take a nap. And then I'll call when I'm done, and can we have the same sort of like, anything you noticed, and this is what I noticed, this is what I'd like you to try to do, and then schedule the next session. And what happens in the remote, because people are like, how do you do that from far away? Um, it's since I don't touch you when we're in the room, it's sort of the same kind of thing. The best way I can explain it to people is like sort of your telephone, your cell phone, and then like your little Bluetooth in your ear. So everyone has their own energetic frequencies, or like fingerprints or retina or whatever. Everyone has their own unique energetic frequency. And if you have the medical qigong training, sort of like search for that frequency, that person, and when you find them, you're like, ah, there you are, and you sort of set up this direct sort of line. And then once you're plugged in, so to speak, like the little blue lights flashing, like you're good, you're on, then you can send energy through that conduit that's open now.
I
So
absolutely love that description, the
yeah.
idea that each person is almost like a radio station, that if you know what their frequency is, that you can dial in and it's their unique little
Mm-hmm.
broadcasting station that
Yeah.
you, Laura, can pick up on and listen to.
Yeah.
So that's
I'm like,
really
are you feeling country today? You're feeling kind of jazzy?
yeah, exactly. So let's back way up.
Okay.
You talked about getting trained in this. How did you even learn this was a thing? How did you
Whoa.
learn how to do it? And when was that? And give us a little bit of the background.
Background. So I see the very first introduction I had was back in what have been 2004. I went to a bodywork conference, an Asian bodywork conference, because I have training in shiatsu as well, and I went to this conference, and there was a guy who was like still one of my like, oh, you're so awesome. His name is Jerry Allen Johnson. He's a huge medical qigong pioneer in the West. Has been doing it forever, does all kinds of crazy awesome stuff. And he was there to talk about medical qigong in the treatment of cancer and tumors and things like that. And some of the results and case studies that he shared, I was just like, what is this stuff and why isn't it everywhere? Like, oh my God. And you could like just feel him. He would walk in the room and you were like, something just happened. Like what? He's just got a very big field. And I was like, something is up with this. I want to figure out what it is. So when I got home, I got in touch with someone who was coming to town on a like continuing education thing, and they were teaching a qigong form, and I was like, I want to learn it. So I learned that, loved it. And then when I moved to Boston in 2008, yeah, to start or finish up acupuncture school, I found a classmate who had been doing a lot of qigong training, was very advanced, and he kind of took me under his wing and started teaching me other cool stuff. And then 2010, I think it was, Paul Fraser, another huge, awesome guy. He's kind of my mentor. He studied under Master O, who is the person who developed Pangu Shengon, which is the Qigong that I teach and the energetic frequency that I use to help people. He's a grandmaster in China. He's relocated to California, but he's got a very awesome story, and he's just the best man ever. And so Paul Fraser is one of his senior students, and Paul went around and taught the form and kind of taught a medical qigong course as well, to go along with that. And I took that course with him. And then when Master O came to Boston, I furthered my training by taking classes with him, and then decided to get certified as an instructor to teach the first part of the form, which is the moving form. And then all that finished up in around 2011, and started treating just like my cat, and my sister, and tried to do long distance stuff with my mom, and had like really crazy awesome results with it. And I was like, this is like really a thing, like, because when you start out doing stuff, you're like, nobody knows what this is, and the concept in your head, you're like, this may not actually work. Oh my God, it worked. So and remote stuff was working and everything. I was like, this is really cool. And of course, I was going through acupuncture school at the same time, and I started to notice that my treatments were changing once I started doing the qigong regularly. And I had asked Paul about it one time, and it still happens now with Gen Care. I ask Paul, I'm like, even if I'm focused on acupuncture and they're talking to me the whole time and like whatever, like, and I'm not trying to send energy to them on purpose, like, is it still happening? And he was like, yeah. He's like, at this point in your training and everything, you are like, if you focus on like chi, and the energy always follows intention. So if you set your attention on something or someone, and your intention is to be healing and loving and do well for this person, then if you've got a big enough chi battery, it just starts to be like, oh, well, we got stuff to do. And which is really cool. It'd be better, of course, if I was actually like, this is what I'm doing. But it's nice to know that almost that I'm not alone. There's something else that is helping these patients to have another level of feeling good. And the form that Mastro teaches is very about loving, being kind, um, trying to help anyone and everyone, and just being benevolent and not causing harm, that sort of thing. That's the whole basis and premises of it. And so when you have people who are having a hard time, be it physical, mental, emotional, like, or just life sucks, it's really, it's nice to come into contact and be like, I know that something's good will come out of this interaction, so
Right.
that's sort of, did I answer everything that you asked?
Yeah, you did.
Okay, it was sort of a roundabout, like,
Yeah,
sort of all over the
I could
place.
talk all day about this because I still find it so fascinating that this exists, and I knew so little about it, even being sort of even tangentially in that world.
Hmm.
Um, so, Laura, we just have a few minutes left. So, I do like to ask people that in these crazy times we're going in, what is your favorite, best piece of advice for people on
Mm,
how to stay safe or sane or all of the above?
yeah, I hear you. I actually have several of my clients and patients who have been in touch with remote work and stuff, and they're sort of like, "How are you doing with all this stuff?" And there are a couple of things that I just tell people. Like, the first most important thing is that, since sort of like everyone has their own little frequency, there's also a big sphere of influence energetically that we all swim in all the time. And then everyone has within their own frequency, you have a sphere of influence where if someone's close to you, or either proximity or just close in relationship, like a daughter or a spouse or cousin or mom or dad, whatever, that you can influence each other. So if you are, kind of in a good space, a calm space, like, you can influence someone around you who is not that way, to
Hmm.
to calm down, be better. Like, vice versa, someone who's having a bad time can come into your happy sphere, and all of a sudden you start being irritable, cranky. You don't really know why. Now you have a headache. Like, what? And so what we talk about in qigong is having a big enough battery that if something is around you that you don't particularly want, it can't get in. And it doesn't have to be qigong. There's tons of different ways that you can fill up that battery, so to speak, for yourself. That's a good thing. So whatever you love to do, if you love to sew, if you love to cook, if you love to be outside in nature, if you love to, just laugh and watch stand-up comedy all day long, whatever you love to do, whatever brings you joy, do more of that right now, because it will fill up your calm, happy, joyful battery. And all the stuff that we're swimming in right now, there's hysteria and panic and like all that kind of energy going on, and I can't stay in my house, I'm going crazy, like all that stuff. The more joy, big battery you have, the less the outside stuff gets stuck to you or you pick up on, and then you can stay in that state, which is very important because cortisol is related to lower immunity. Cortisol is a stress hormone.
Hmm.
If you can keep your stress low, your body has a much better chance of maintaining and staying healthy and doing all the things it needs to do. Also, eat well, do all those fruits and veggies, guys, um, and um, and try to do a little bit of exercise, a little bit of movement, whatever you love to do, and also make sure you're getting enough rest. Rest is also really important and key for the immune system to do everything that it needs to do. It needs time to focus on the body and not on other things.
Right.
And so good rest, good diet, and a happy heart. And that's pretty much the best stuff I got.
That's great. I also am telling people, yeah, you got to get back to the basics, which
Yeah.
is sleep, food, and just,
Food
being
is the first medicine, always.
always. And sleep is where our immune systems actually go to work.
And have a chance to do stuff without us
Cellular
doing things.
level. But I love what you said in your advice, because everywhere people are talking about, oh, this is what you do to boost your immune system. But they're really talking about the physical. But what
Hmm.
a lot of what you talked about was immune system for your, I don't know, spirit, if you will.
Your
And
spirit, your soul, just you, like, because your conscious mind, and but also your heart, your soul, like who you are as a person, like it really matters
yeah,
to nurture that for the body. If
yeah,
you are unhappy, your body's capacity to do stuff goes. If you're angry, it really goes down.
yeah,
It's a very interesting thing. But joy, laughter is the best medicine. It's not just a saying, people.
yeah.
It's a real thing. And hugs, where at least if you're in your family, you have to be 6 feet apart from people, or just like making sure that people, that you do whatever brings you to that calm, happy, like this is cool space. Then that's the good stuff.
That's great. And hearing it, hearing the words, everyone can be like, yeah, I need to do that. But some people just don't know how. And that's
Yes.
where someone like Laura Wong, with Medical
Yes.
Qigong can help.
Yeah,
You know,
absolutely.
someone like in your practice can really teach people how to get in touch and access these things so that they can boost their mind, spirit, body, immune system all around.
Mhm.
So we are sadly at the end of our time, but I
Time.
had such a good time talking to you. And
Yes,
anyone
you too.
was piqued by this and wants to learn more, I'm going to post your email and phone number, but just your email is laurawongqigong@gmail.com.
Yep.
And to reach you by phone, it's 602-561-1757. And I personally know that a lot of my patients could benefit from this because, some people just need a little extra help, especially in these times. And the fact that you can do it, by telemedicine is just
Mhm.
a bonus, right? So
Yeah.
there's no excuse, people. Give Laura a call. And
Mhm.
thank you so much, Laura. And I hope
Sure
to
is.
have a part two sometime soon.
Yeah, I'm around.